industry analysis is focused on female sexual health, more specifically on pain management in sexual health. In our presentation, we will describe this industry, the market segmentation and size, the key stakeholders, non-market forces, and notable market trends. We are Team 1, including Jake, Lisa, Marta, Hasiba, and Loretta. We will first start with industry and scope. The women's sexual health industry is broad. One component of the sexual health industry is reproductive health, which consists of different contraception methods, as well as tackling infertility issues and providing fertility assistance. Another component is the pathology portion, which consists of chronic diseases. This also includes sexually transmitted diseases, their prevention, and treatment. Lastly, overall sexual well-being is a major aspect of the sexual health industry. The World Health Organization defines sexual well-being as education and treatment in human sexuality. Studies have been conducted showing that positive sexuality has an overall beneficial impact on the overall well-being. For example, healthy sex has many medical benefits, including a reduction in stress and anxiety, as well as increases in immune system activity and a reduction in blood pressure. In women's sexual health and sexual well-being, there is another component including pain management. Statistics show that 50 million women in the United States experience chronic pain from different types of disorders. Chronic pain reduces sexual functioning in 80% of these individuals. Many women with reproductive disorders experience pain during intercourse. Additionally, women experiencing postpartum pains also fit within this category. Depending on the disorder, there are medically prescribed treatments including anti-inflammatories, different medications, hormone or pelvic floor therapies, as well as surgery. There are also holistic solutions, including sex toys, creative sex positions, alternatives to intercourse, and pelvic pain prevention devices, all of which can alleviate pain felt during sex. Many of the solutions for painful intercourse are not covered by medical insurance and/or are not the most effective in treating sexual discomfort. Therefore, new medications and devices are needed to overcome these issues.
Pain during intercourse is a significant issue. Pain during or after intercourse is referred to as dyspareunia. There are many causes of this pain which have been mentioned. These include fibroids, ovarian cysts, ectopic pregnancy, infection, endometriosis, shallow vagina, and genitopelvic pain penetration disorder. With all of these different causes, one might assume there are numerous treatments to help with such an issue. There are not, and many times, if there is treatment, it may include surgery or other invasive procedures.
Emily Sauer, founder and CEO of ONET Medical Devices, found that market segmentation is unreliable on the basis of these typical diagnoses. Not every woman with this diagnosis experiences chronic pain during sex, and oftentimes, although chronic pelvic pain does exist, it's not just during sex, it might be in their day-to-day lives. So that, along with the multiple comorbidities associated with these diseases, lead to us focusing the segment on specifically females who experience chronic pelvic pain during intercourse, regardless of the reason as to why that's the case. And also it has to be chronic as opposed to just one-time instances of that pelvic pain.
There are around 174 million women in the United States, of which 20% experience pain during intercourse. Given there are very few non-invasive treatments, many women do not ever seek any help. Of the 30 million women who experience pain during intercourse, we can assume that 5%, which is a relatively small population, would be willing to purchase an over-the-counter product to help alleviate the pain during intercourse and help increase their sexual health and well-being.
Very little research is available to market size this specific segment due to the lack of historical research and funding for female sexual pain, and very few companies that are currently in the market producing consumer-facing products that are sold in the market to address this issue. So as a result, we took the sexual wellness market, focused on the $25 million a year it takes for the average cost to treat chronic pelvic pain through the medical solutions we discussed, for example, surgery. So this market is about $40 billion currently and expected to go 305% over the next 7 years. And this market does include sex tech devices. So then we take it a step further to look at the online presence of sex tech devices and pull that out of the market. So the average cost for these devices and the wearables for women is about $65. And then we associate that with the market segment, which is 5% willingness to purchase an over-the-counter product based on the 30 million women that Jake talked about. So we get an online revenue opportunity for about $1.5 million, which we can expect to grow to $4.58 million based on that 305% growth rate. And so this focuses on the female satisfaction that is increasing the demand for this product, along with key stakeholders and non-market forces that are driving this product to fruition.
The key stakeholders for our market are female patients, their sexual partners, medical device retailers, adult novelty distributors, funders, payers, healthcare clinicians, and regulators. We've all heard that when you have your health, you have a million wishes. When you don't, you have only one wish, and that is to have health. With advancements in technology and better accessibility to healthcare, more patients are taking control of their health. It's no surprise that patients are the biggest stakeholder, while the most important and underrepresented stakeholder are female patients when it comes to pain management for female sexual health. As patients, females will have illnesses which aren't immediately diagnosable and will suffer in pain silently. Female patients constitute the main user and buyer segments. Sexual partners are another huge puzzle piece of the stakeholder aspect, as they are the ones who suffer with their female counterparts, causing a disconnect in their relationship. The next stakeholder we have are funders, who are mainly women, as female entrepreneurs have seized the female sexual health market. Healthcare clinicians, such as sex therapists and gynecologists, also have a stake in this company, either by giving referrals for the device, or some of which work in a private practice setting which carries a product in office. Medical device and adult novelty retailers will be proponents as well, which gives female patients the access to this female health device without a prescription. Payers and regulators are the last to sign off and adopt devices for female sexual health. While there is currently no coverage for these devices, with the awareness from nonprofits such as Lady Parts Justice League, hopefully in time they will address the visible need for female pain management and sexual health. Next, we will segment into non-market forces and notable trends.
Sexual health is an important part of our physical and emotional well-being, though there are a lot of people who find some discomfort in detailing anything to do with their sex lives. Our bodies, sexual health, and sex lives are commonly seen as private matters. So when speaking about tackling female sex health in conjunction with the use of medical devices, there must be an understanding of the impact to the business when introducing such devices into the marketplace, and the forces that manifest outside the scope of the market. The non-market environment, and most importantly, how to address it. The non-market environment consists of the cultural, social, and political structure, interactions among companies and the public. Among different cultures, subcultures, and individuals, they each have different sexual health needs, expectations, and choices, which are derived from education, lifestyle, religious views, ethnicity, and sensitive perceptions such as anxiety and embarrassment. Cultural differences and attitudes to sexual health is a hindrance for this industry. How we consider issues to do with sex, how we speak about it, and how we deliver service to support sexual well-being, all has an enormous impact on how service will be acknowledged and used. The American public has a complex relationship with sex. Some have liberal attitudes towards sex while others are conservative, which has a lot to do with generational differences. Chinese and Indian cultures around sex promote silence and shame, whereas Europeans are more open and accepting to sexual health conversations. According to a 2017 study in the Journal of Sexual Medicine, a majority of women will experience symptoms that can deter or derail their sex lives as they age: pain with sex, dryness, decreased libido, and pelvic pain. Shame surrounding not being able to be open about sex issues is perpetuated negatively in media, the TV, and movies as bad sex. Government insurance-approved products for painful sex is considered a lifestyle choice, thus making it hard for women to get medical attention and information, especially if insurance doesn't cover. Sexual health is a part of a woman's mental health, physical health, and psychological well-being. Involvement from the insurance company will drive accountability and better access and quality of care for women suffering with pain. A recent PR Newswire report states, with the rising awareness among end users and rapid technology advancements to explore healthy aspects of their sexual life, the market for sexual wellness is expected to gain traction between now and 2024. The sexual wellness market is witnessing a significant growth while focusing on women customers. One of the main key drivers and trends fueling the growth of this market is the integration of sexual education and sexual health based on the market research, given the industry is expanding. In our next presentation, we will focus on how medical device companies such as ONUT are making waves in the industry and pushing forward with this new device for the betterment of women's sexual health. Thank you for joining, and we look forward to part 2.